I'm Dr. Louis Blevins of Pituitary World News, and we're here at the Endocrine Society Meeting in San Francisco. It's the 2025 year for this program, and I've ran into Dr. Goldenberg, who's done some really interesting work on the cortisol pump. There's been a lot of interest on Pituitary World News from the patients who follow us about using a cortisol pump to treat central adrenal insufficiency and also primary adrenal insufficiency. So I'd like to have her share her research work with us, and then we'll talk about this as a potential therapy for some of you out there with adrenal insufficiency who are interested in this treatment.
Thank you very much for inviting me. I'm very excited to have this poster because it's the work of my last 9 years in medicine. I do have close to 30 patients here reported on cortisol pump. It's usually people who have had challenge controlling their adrenal insufficiency with oral versions of therapies. So I started offering them insulin pump with cortisol, with Solocortef, and now we have this many people, and they are a good mix of patients. They are primary or secondary or even tertiary variants of adrenal insufficiency. I found that we do require different versions of adrenal replacement. We teach the patients how to use the pump, and as a result, most of them do really well on the pump. They have improvement of their quality of life. They do go to emergency room much less compared to before, and their metabolic profiles become better as well. So I do find as well that a lot of my patients happen to be very complex, with complex medical histories, but not only them may benefit from cortisol pump. Any other questions?
So I had a couple of questions. One, do you feel like this should be tried first, or is this only for people who fail traditional oral replacement therapies?
It's probably as a second line of therapy, because yes, it does work really nicely, but you can have side effects as injection site reaction, different intolerances to medication, and it is, if your patient is controlled with orals, of course it's much easier. But for people who have not had good control with oral therapy, this becomes option that can be life-saving. A lot of them do say that the pump saved their lives.
Do you find that patients are able to learn to manage their dosing on their own?
Yes, they do. Of course, most of my patients are highly intelligent, and because of that, I trust them to be co-creators in a sense, and they help to learn from each other and from me. So it's a process.
Well, thank you for sharing your time with us today and the results of your studies. You'll be hearing more, because I want you to write a brief article or do a podcast with us to talk more in detail about how you bring patients onto this form of therapy.
Absolutely. I am very, very passionate about helping patients with adrenal insufficiency who have failed other treatments, and I do feel this treatment should be available for a lot more, and we need to educate providers about adrenal insufficiency and different options of treatment.
Thank you very much. We appreciate it. Have a great rest of the meeting.
Thank you.